For the first time ever, scientists have found a way to safely send drugs into the placenta during pregnancy. Now, the breakthrough may mean that one day premature births will be avoidable altogether, and drugs will be able to pass through to the placenta to treat common complications that often occur during early pregnancy, something which up till now has not been possible. Well, scientists at the University of Santa Barbara, California, have made this incredible breakthrough. It really is an incredible breakthrough because up until now, the placenta has not been strong enough to take drugs to pass them through to the fetus. So the fact that they've been able to find a way to strengthen the placenta throughout the pregnancy and to therefore mean that we can treat fetuses with all sorts of issues, or a placenta itself which isn't developed properly, means that we can avoid induced labor. So often what happens when a placenta is not growing or working properly is the doctors and nurses, they have to induce the labor. Now, this can obviously save the lives of a mother, but so often the baby then is ending up in a situation where they might have cerebral palsy, heart disease, diabetes, and often being obviously in an incubator trying to recover an early premature birth. So they found a way to pass peptides through to the placenta. I'll talk a little bit more about that in a minute, but it's certainly a groundbreaking study and means that we might be able to avoid premature births and obviously sick, poor little fetuses altogether in the future.
This is designed to keep babies in their mother's womb longer. That would be my assumption.
To treat them when obviously things are going wrong during pregnancy.
This is so fascinating. You know, we know that this placenta aspect of pregnancy, it's supposed to be this membrane that encapsulates and protects a baby. And so many women, you know, you hear of cases specifically in women that are of advanced childbearing age where they have babies that are often born premature or have developmental issues. And the fact that we're in this stage, Joe, where we can keep these babies in wombs longer and have healthier babies with longer terms of development in terms of pregnancy, this is groundbreaking. It affects a lot of people. I was looking at an article over drugs being administered to pregnant women with HIV, and the common concern was, you know, the placenta aspect and how is that medicine affecting the fetus in the mother's womb. And the fact that we're here now and we're seeing this groundbreaking stuff happening, you know, it really means a lot of people, lives sustained and premature infants impacted, which is a great thing.
This all happened because they were able to make comparisons and to realize that the placenta actually acts very much like a tumor. And so given that in mind, they were able to then go about strengthening the placenta and targeting it with peptides, which are chains of amino acids. So what this means, obviously, is that in the future, we can administer drugs, we can administer treatment when a fetus is not growing properly. And it means that in the future, this obviously is a groundbreaking study that opens up the door to treating babies inside the womb rather than having to induce labor and having them born prematurely.